Assalamualaikum warahmatullahi wabarakatuh, and good day to everyone. Today I would like to present to you regarding COVID-19 management on the EMSH5103 Safety and Health and Environment Management. Briefly describe regarding our project background. Today I would like to choose KVMRT project, line 2 from Sungai Buloh up until Putrajaya. Okay, there is 51 km for PSDS project power supply and distribution system. Okay, objective for this assignment is to prepare high-rec for project sites during the pandemic situation of COVID-19. Two scope for this assignment is prevent and minimize the spreading of COVID-19 at the workplace, enable project site to manage site effectively, activity safely. Okay, when we talk about Safety and Health Environmental Management Organization, CRSC already comply with all necessary regarding on that. Okay, they have a C committee, which is their scope is to ensure legal and requirement is followed, ensure management system are complied, and ensure there is policy regarding on safety and health environment, and to implement management system to our organization. Okay, briefly describe regarding on COVID-19 history in Malaysia. Okay, once WHO has already termed the novel coronavirus in back 2019, then it is spread in Wuhan 2020, January 23, and then reported case in Malaysia in March 2,766 cases, and then after all the spike issue rising at Malaysia, then MOH launched a MCO in Malaysia to flatten the curve. Regarding on COVID-19 and their symptoms, COVID-19 can be spread person to person. Okay, the symptom is like common cough, fever, shortness of breath, sore throat. But 80% of people recover from this disease without any special treatment. But around 1 out of 6 person who get COVID-19 become seriously ill and develop serious breathing difficulties. Older people and who are with underlying medical problem will surely got high risk for this infection. COVID-19 can be transmitted through another person through contact with droplets of an affected person from coughing and sneezing. When we talk about risk of COVID-19 industry, there is several risks that we can spell out, such as quality, technical performance risk, schedule risk, project management risk. But today we will focus on environmental safety and health risk, which is workers are exposed to COVID-19 transmission at work. According to George 2009, hazard is a dangerous condition substance that avoidable of risk, although have been able to be foreseen or predicted that lead to an accident. But for this case study, management will focus on the outbreak of COVID-19 at workplace. This hazard is classified as under biological hazard, a virus type which can easily spread to other workers and give effect to their health. Risk assessment at the workplace. Risk assessment is the overall process of risk analysis, identification and estimation, and risk evaluation, measurement and tolerance, according to Campbell 2008. Okay, there is several sequence of work that I identify, such as general activity, CRT workers accommodation, entry access into and from site, mass gathering such as to walk talk and so on. But I can focus on 3 major items, which is travel from high risk location, personal attend program event outside the workplace, personal travel using transport that may cause exposure. Regarding on prevention and control of COVID-19, there is several that I identify based on this case study. But this time we will focus on high-rec. After run through the higher process, we identified that several activities need to be done to control the spread of COVID-19, such as take the measurement of temperature at site, physical barrier demarcation, washing facilities and sanitizer, isolation room and area, toilet facility, site office arrangement, which is we need to act and write at the places, which is we include social distancing, personal protective equipment such as mask, waste bin or discard PPE such as bin, especially for COVID-19 PPE. Then the important one is RT-PCR and RT-PCR. When we discuss regarding on high-rec, there is a flow chart with when and how we can do it. Firstly, we classify the work, employer, consultation with worker, identify hazard, and do the risk assessment, discuss regarding on risk control, implementation at site, and then we review the effectiveness of that site. This is high-rec form that we use in CRSC to determine the process and risk control and control measure at site. The important part of this assessment is expectation to the management on the prevention control implemented effectively. First, safety and health climates and culture of an organization are important factor in ensure the effectiveness of risk control. Number 2, employer shall maintain a safe system of work at site and review frequently to make sure the implementation is good. And then at site, the site people need to make sure the communication or provision implementation maintained to prevent COVID-19 spread. Employers shall communicate to all employees at site to make sure that implementation on site is compliant, including personal hygiene and respiratory etiquette. And then employer must remind all the employees regarding on-hand hygiene and give their training and give all the necessary information via email, social media, and etc. Specifically, CRIC must set up a guideline and explain to all personnel and carry out the audit and inspection to maintain the compliance. Also, they need to identify the high-risk personnel to COVID-19 infection and ensure they are engaged in activity that provide low-risk exposure.
By the time the risk occur at site, it is a bit too late to do anything. Then that is why it is so important to plan for the risk on the early stage and plan for the back on track. Thus, the acute effect of this is obviously we can see by the widespreading and devastating effect that affecting our workers and financial perspective of view. Right? Then we can observe that many industry nowadays suffer from budgeting cuts due to the COVID-19. Thus, the understanding and development of OSH-MS is the best way to fight this pandemic issue. Then HIREC is the important tools in OSH-MS in order to risk assessment and determining control in effort to reduce and eliminate the COVID-19 effect. Okay. Infection control plan and return to work plan is important to the organization in order to back on track. Okay, lastly, support from the management is one of the key to make this all effort is successful. By having good safety plan procedure, risk assessment, prevention control, that is the best method for management to implement at project site.